Thank you all for coming. Hi, I'm Cindy Koss. I'm finishing up my first year at Cowley College. This presentation is for my public speaking course. As a person who has lived with multiple people who have diabetes, including my husband of 15 years, I've learned a lot about how to live with it. So today I'll be sharing information about the symptoms, diagnosis, and treatment of diabetes, as well as what exactly diabetes is. According to the Mayo Clinic, there are 3 types of diabetes: type 1, type 2, and gestational. Type 1 diabetes, formerly known as juvenile onset, is an autoimmune disease. The immune system attacks the islet cells of the pancreas that make hormones including insulin. This either eliminates or greatly reduces the pancreas's ability to balance the body's blood sugar. This is largely unpreventable and is caused by genetic, childhood illness, and environmental circumstances. Type 2. The pancreas produces insulin, but the body doesn't use it properly. If type 2 goes uncontrolled, it can become type 1. Gestational diabetes is a condition in which a pregnant woman without diabetes develops high blood sugar levels during pregnancy. The glucose passes through the placenta and gives the baby high blood sugar as well. Both mom and baby are at higher risk for long-term diabetes. There aren't any guarantees if they will or will not develop diabetes or not. Step 1, prevention. For all types, diet and exercise can help manage your blood sugar. This includes making sure to get at least 30 minutes a day of exercise and eat foods such as fruits, vegetables, and whole grains, specifically those high in fiber. Knowing your risk factors will help you know how likely you are to get diabetes, but your best bet for prevention is a healthy lifestyle. According to NIHHC, risk factors include your family medical background, weight, age, ethnic background, high blood pressure, smoking, and overdrinking. Step 2, know the symptoms. According to the Mayo Clinic, your symptoms will depend on your blood sugar levels. Excessive thirst and urination, unexplained weight loss, feeling lethargic, irritability, blurry vision, slow healing sores, and frequent infections are signs of diabetes. Diabetics I know have each commonly experienced profuse sweating as well as slow thought and speech and confusion as signs of being low. For having high blood sugar, they have said feeling hot, stomach aches, and tiredness are common signs for them. Step 3, diabetics need to test their blood sugar often. This can be slightly painful, but you will get used to it. Set a schedule, but also test if you feel the need. Blood sugar monitor options include basic blood glucose monitors. Testing involves pricking your finger and collecting blood with a little strip multiple times a day. Continuous glucose monitors are small discs that are placed on your arm or leg through an applicator. There is a wire that remains in your skin while the monitor is on you. The lifetime of these depends on the brand. They come with remote readers. Most have apps to allow not only you, but your loved ones to keep track of your blood sugar. Step 4, treatment for blood sugar issues. For low blood sugar, below 70, also known as hypoglycemia, the CDC states that you need to get sugar into your system quickly. Beverages such as orange juice and soda, and foods such as candy, applesauce, and honey are good natural ways to get the blood sugar up. Glucose tablets and gel are also good, but I have been told they taste bad. If your blood sugar gets dangerously low, 54, the glucose pen Gvoke is a good option to keep at home. EMS is also a viable option, but only if your blood sugar is below 34, as they won't treat you otherwise. They will have a glucose IV available. For treatment and prevention of high blood sugar, also known as hypoglycemia, manufactured insulin is the only option for type 1 diabetics and may be necessary for type 2 diabetics. There are 5 types of insulin. The different types have different speeds and lengths of acting. Speak with your doctor to decide which one is best for you. There are multiple delivery systems, the traditional syringe and vial, preloaded pens, and pumps, which also double as continuous glucose monitors. There are also inhaler options. They each have positives and negatives, so you should find what is best for you. This seems like an awful lot to deal with, and lots of pain involved to multiple injections and testing pricks throughout the day. So why do we bother? There are actually many horrific consequences to uncontrolled diabetes. 3 big life changers being loss of sight, loss of limb, and even loss of life. So here are some tips and tricks to help make life easier for yourself or your diabetic loved one. A little easier. For diabetics, keep treatment essentials on you at all times. Carrying a backpack is a great way to do this. The right size bag can fit not only your basic supplies, but also emergency snacks. Make sure to let your loved ones know that you are diabetic and how to tell if you are low. For those who have diabetic loved ones, keep their favorite high sugar snacks in your house and labeled for emergency use. Have a spare blood sugar machine, bottle of their favorite insulin, and a pack of syringes in case of emergency. I hope my speech today has given you more insight, knowledge, and understanding as to what diabetes is, how to treat it, how to live with it. Thank you all for coming. Have a wonderful day.